Welcome to Serenity Palace. Have you experienced a life-altering event that changed how you connect with others? Trauma can significantly impact our attachment styles, often leading to shifts in our behaviors and emotional responses. In this video, we'll explore how trauma can reshape your attachment style and offer insights into the healing journey. Trauma can profoundly affect our lives, influencing not just our mental health, but also our attachment patterns. Attachment theory suggests that our early relationships lay the foundation for how we connect with others. However, when trauma occurs, be it through loss, abuse, or significant life changes, these patterns can shift dramatically. Let's begin with understanding the impact of trauma, shifting from secure to insecure. For someone who has a secure attachment style, trauma can introduce feelings of fear and anxiety. This shift may lead them to develop an anxious or avoidant style, creating challenges in their relationships. They might find themselves overreacting to perceived threats or withdrawing from intimacy altogether, exacerbating insecure patterns. Individuals with pre-existing insecure attachment styles may experience heightened symptoms after trauma. For example, someone with an anxious attachment might become even more clingy and preoccupied with their partner's availability, while someone with an avoidant style may retreat further into emotional distance. The role of healing from trauma is essential in reshaping attachment patterns. Engaging in therapy or support groups can help individuals process their experiences, recognize their triggers, and develop healthier coping mechanisms. Therapeutic approaches like cognitive behavioral therapy, CBT, or eye movement desensitization and reprocessing, EMDR, can be particularly effective in addressing trauma-related issues. The key here is to be kind to yourself as you work through the flashbacks, fear, anger, and sadness, which leads us to self-compassion. Understanding that your attachment style can shift after trauma is crucial. Practice self-compassion as you navigate your feelings and behaviors. Recognize that it's normal to experience changes and that healing takes time. Open communication. Talk openly with loved ones about your feelings if they are willing to hear some emotional information. Sharing your experiences can help strengthen relationships and foster understanding. Seek professional support. A therapist can guide you through the healing process, helping you to rebuild trust in yourself and others. They can assist in developing new, healthier attachment patterns that allow for deeper connections. Mental health therapists who are trauma-informed and/or PTSD specialize in childhood trauma treatment and have extensive training and knowledge in addressing your specific needs. They may engage in focusing and working through childhood experiences. This can entail talk therapy, psychotherapy, or, as mentioned, EMDR, CBT, and journaling, which is a powerful tool. The journey of healing from trauma is complex, but it's also an opportunity for growth. By understanding how trauma can shift your attachment style, you can take proactive steps toward rebuilding your connections with others. Be patient, as the healing is a process, and every step forward is a step toward a more secure, fulfilling life. Make sure to like, subscribe, and tap the notification bell